Have you ever stopped and wondered how doctors can get this perfectly clear, detailed map of your arteries and veins? All those intricate rivers flowing inside you without ever making a single cut? Well, today, we're diving into the incredible technology that makes it possible. Magnetic Resonance Angiography, or MRA for short.
Right? That's the big question. It honestly sounds like something straight out of science fiction, but this is a real diagnostic tool that helps save lives every single day, spotting dangerous blockages, bulges, and even tears in our blood vessels. And the answer, well, it lies in this powerful, kind of elegant combination of magnets and radio waves.
So, to really get how we can see blood flowing with MRI, we first have to back up a tiny bit and get a handle on its parent technology, which is magnetic resonance imaging, or MRI. They're built on the exact same fundamental principles, so once you get one, the other makes perfect sense.
And here's the crucial part to remember. MRI is non-invasive, and unlike X-rays or CT scans, it uses zero ionizing radiation. Absolutely none. Instead, it harnesses the power of a giant, super powerful magnet and the tiny little protons that are already packed inside your body's water molecules.
Here's a cool way to think about it. The MRI machine uses its magnetic fields to give every single proton in your body a unique frequency, all based on its location. It's kind of like how every radio station has its own specific spot on the dial. The machine then just tunes in to those specific frequencies to build this incredibly detailed map of your internal anatomy.
So how does that actually work? Well, it's basically a four-step dance. First, that powerful magnet makes all the protons in your body line up, all facing the same direction. Then, step 2, a quick pulse of radio waves comes in and knocks them all out of alignment. Step 3, the pulse stops, and the protons snap right back into place, and as they do, they emit this tiny faint signal. And finally, a really powerful computer listens to all those millions of signals and translates them into a picture. And those loud clanging and banging noises you hear during a scan, that's just the sound of magnetic gradients switching on and off really, really fast to pinpoint exactly where each of those signals is coming from.
Okay, so now we get how an MRI sees stationary tissue. But how do we make it specifically highlight the flowing blood inside our arteries and veins? That's where MRA comes in. It's essentially just an MRI sequence that's been fine-tuned to make your blood vessels the absolute star of the show.
And there are two main flavors of MRA. The first one, non-contrast MRA, is super clever. It uses the motion of the blood itself. With a technique called time of flight, or TOF, it basically highlights the fresh blood flowing into the area being scanned, making it show up as bright against all the surrounding tissue that's just sitting still. Then you've got the other method, contrast-enhanced MRA. For this one, a special agent with something called gadolinium is injected into your vein. This agent makes the blood extremely bright on the scan, which often gives you these super sharp, really detailed images. And a huge advantage here is that it needs a much smaller amount of this contrast agent than what you typically use for a CT scan.
Okay, so we've got this incredible tool, but what can doctors actually find with it? This is where MRA's power just absolutely shines. It lets them take a guided tour of our internal rivers to spot problems sometimes long before they become catastrophic. Let's start with the biggest river of them all, the aorta. MRI is just fantastic for checking it out. Doctors can spot aneurysms, these are dangerous bulges in the artery wall, and even aortic dissections, which are life-threatening tears. It's also absolutely crucial for planning complex surgeries, like figuring out the best way to place a stent.
And this is where you can really see the precision of MRA. For the carotid arteries, those major vessels in your neck where a blockage can lead to a stroke, we're talking a 95% sensitivity for detecting severe narrowing. That's incredibly accurate. And when you look at arteries in the legs, it's a clinical standard, with an unbelievable 99.5% sensitivity for finding significant problems. It can even see these tiny little vessels way down in the feet, sometimes better than older, more invasive methods ever could.
MRA is also a total game changer for the kidneys. It can identify something called renal artery stenosis. That's a narrowing of the arteries that feed the kidneys, which is actually a potentially curable cause of high blood pressure. And for something as critical and life-changing as planning a kidney transplant, MRA can map out a patient's unique vessel anatomy to help make sure that surgery is a success.
Now, as amazing as this technology is, like any medical procedure, MRA isn't for everyone. It's incredibly safe, for sure, but there are some really important risks and limitations that doctors have to weigh for every single patient. The biggest issue is metal.
That super powerful magnet means that certain implanted devices can be a problem. Pacemakers used to be an absolute no-go, but today many modern devices are designed to be MR conditional, which means they're safe to scan under very specific conditions. Other metal implants like stents or coils are usually fine, but they can sometimes create these little distortions in the final image, kind of like static, especially if they're made of stainless steel.
Now, when we talk about that contrast-enhanced MRI, the main safety concern that comes up is a rare condition called Nephrogenic Systemic Fibrosis, or NSF. It's a very serious disease that was linked to some of the older types of gadolinium contrast agents, specifically when they were given to patients who already had very poor kidney function.
But here is the really important context. Thanks to much better patient screening and the development of newer, safer Group 2 contrast agents, the risk of NSF has just plummeted. For patients with severe kidney disease, the highest risk group you can have, the likely risk is now less than 0.07%. It has become an exceedingly rare event.
So MRA is powerful, but it's not the only tool in the box. Its main competition is something called Computed Tomographic Angiography, or CTA. And choosing between them, well, that's all about weighing the pros and cons for the job at hand.
This is a choice that doctors have to make all the time. Both MRI and CTA can give them excellent pictures, but they get to that result in completely different ways. And each one has its own distinct advantages and disadvantages, depending on what's going on with the patient.
All right, let's break it down. The big difference, the headliner, is that CTA uses X-rays. That means a dose of ionizing radiation. MRA, on the other hand, uses 0. But here's the trade-off. CTA is incredibly fast. We're talking a scan can take less than 5 minutes, compared to 30 minutes or more for an MRA. That speed makes CTA perfect for emergencies. MRA, though, is a fantastic choice for younger patients who need to avoid radiation, or for looking at arteries that are heavily calcified, because that calcium can sometimes cause problems on a CT scan. So you see, the right choice really depends on the patient and exactly what the doctor needs to find out.
And that brings us to the future. So where does this all go from here? MRI is already an incredible diagnostic tool, but the next frontier is even more exciting. Researchers are now developing techniques that don't just see the size of a vessel, but can actually look at the plaque on the inside, analyzing its chemical makeup to find the unstable, dangerous plaques that are most likely to rupture and cause a heart attack or stroke. I mean, just think about that. Being able to see that risk before it becomes an emergency. That is the incredible power we are unlocking right now.